Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Devesh is working in a CUO in a company and he has a traveling job. He is now diabetic controlled on oral hypoglycemic drugs. On his recent visit to the doctor, his blood pressure was found to be 164 by 102, which is the most suitable drug in the patient. So it is hypertension with diabetes mellitus. The best drug is actually beta blockers and thiazides are avoided in the diabetes mellitus patients, and he is in frequent traveling job, so he is likely to miss the dose. If he is in traveling job, he is likely to miss the dose. If he misses the dose with clonidine, okay, then obviously this will lead to rebound hypertension is seen with clonidine. Rebound hypertension with clonidine. So better drug here is enalapril. Moreover, enalapril is also safe and it will also decrease the incidence of diabetic glomerulopathy.
thank you and thank you for watching.